The patient presented with severe periodontitis and bone loss. The compromised clinical situation required full tooth extraction and bone grafting from 13 to 23, followed by guided implant placement. Titanium bars were produced to support the long-term prototype designed and milled in temp premium. After several months of healing, upper and lower arches were milled in Prettau 2 zirconia, stained with color liquid Prettau 2 aquarelle and then sintered. The structures were then characterized with ice stains 3D by Enrico Steger and veneered in the anterior and gingival regions with ice ceramics. The titanium bars were anodized and bonded to the zirconia structures. After verification in the articulator, the final restoration was integrated in the patient's mouth. The therapy exceeded the patient's expectations, re-establishing a natural occlusion without any complications.